Let's go across to a panel of expert doctors joining us this morning. Dr. Yatan Mehta, Chairman of the Medanta Institute of Critical Care, Subhash Goyal, President of the Confederation of Tourism Professionals of India, Chairman of STIC Travel and Air Charter Group. We also have Dr. Sarman Singh, Ex-Director of the All India Institute of Medical Sciences, Bhopal. He's also a senior virologist. Thank you all very much for being with us. Dr. Mehta, to you first. The WHO has declared Omicron a variant of concern. From a variant under monitoring, this has now gone directly to a variant of concern. Just how concerned should we be?
See, when you look at a new mutation in the virus, new mutant, what you look at is how infective it is, how transmissible, that means how much it can spread. Secondly, you look at how virulent it is, how severe disease it can cause, which will be not only a burden on the healthcare system, but also on the increased death rate and morbidity. And third thing you look at is that how the patient's immunity, because of the either vaccines or because of the previous exposure to the disease, is effective against this new virus. So these are the three main things of concern. Now, this one mathematical study has shown this virus to be about 500. Delta variant was about 70% more transmissible. This virus is about 500% more transmissible. So that is obviously a matter of concern.
500% more transmissible?
This is a mathematical model. Yes, compared to 70%, which was Delta variant.
Okay.
So this is a mathematical model which has not been proven by the clinical situation. But yes, this is why probably WHO could so quickly change it from virus of interest to of concern. Secondly, if you look at the virulence, now there is some possibility it is more virulent. Thirdly, if you look at the immunity, now this virus has undergone 32 mutations.
Yes.
That means it is less likely that your standard vaccines and therapies are going to be effective.
Okay.
Most of all these therapies and vaccines work against spike, which is the protein which attaches to the body's cells.
Dr. Mehta, you're making a very important point about the spike protein, and I'm going to come right back to you on that point. Hate to interrupt here, but we do have some breaking news to address at the moment. Prime Minister Modi is going to be chairing an important meet on the COVID situation and the vaccination status. This meeting is going to take place at 10:30 a.m. Akhilesh joins us for the very latest. Akhilesh, what more can you tell us? Is this in the light of the new strain?
Well, it seems that there is a concern at the top level of the government because this new variant has come up in South Africa, and in fact, India is going to open the skies for 15th of December. So, precautions have to be taken and effective steps have to be taken so that this variant does not enter India. And though so far no cases have been found, but ample precaution has to be taken. And also, Prime Minister is going to review the vaccination progress because, as we have been reporting, that there are a lot of people who have not taken the second dose. Now, the government has stepped up the vaccination program, and in fact, they have launched a mass awareness program so that people can come to get their second dose. So, in coming a view of this new variant which has been found in South Africa, there's of course concern at the top government level, and that is why the Prime Minister will be chairing an important meeting on the situation of COVID-19 and also the vaccination with the top officials at 10:30 this morning.
Thanks very much, Akhilesh, for joining us with the latest breaking news, taking stock clearly of the new variant of concern. Prime Minister Modi is going to be chairing an all-important meeting on the COVID situation and the vaccination status at 10:30 this morning. We'll, of course, keep coming back to Akhilesh for more updates on this story. We have a panel of expert doctors who are actually talking about this new variant. Dr. Mehta, apologies for interrupting you earlier, but you were talking about the mutations in the spike protein and what this essentially means. Please go ahead.
No, that also means that the standard vaccines which are there, which are basically acting against the spike protein, may not be effective because the spike protein is modified by the virus. And also some therapies like monoclonal antibodies, they also work against the spike protein. They may not be that effective. So these are the serious concerns, that is why probably the WHO very quickly changed it from variant of interest to variant of concern.
Yes.
So they are also obviously concerned about it. But everything is not gloomy. I mean, if you want, if you look at the better side of it, that the standard PCR tests may be able to detect this variant.
What the WHO so far has said after yesterday's technical advisory group meet is that the current RT-PCR will be effective in determining this particular variant as well. So that's at least some initial relief that one has, because the biggest fear was whether we will now need a new method of detection altogether. While we still don't know for sure about whether the clinical disposition and symptoms will change, Dr. Sarman Singh, as a virologist, the question here really is, Moderna's already said that they're going to be developing a booster specific to this new variant. The question here really is, will we still have protection from severe disease, those individuals who have been vaccinated, especially our vulnerable population, our healthcare and frontline workers?
Yeah, thank you, Risika. This is very, I think, very pertinent question, but it is also true that, a lot more need to be, known about this, because so far about 100 cases they have been reported. And as very rightly Dr. Mehta was saying, this is a virus which has so far reported maximum mutations, and most of these mutations, more than 32, and most of these mutations, they are in the S gene. So this is also very important, because this is the main gene and the protein which makes spike protein, which is used for the protection in the vaccine, as well as for the gene is also used for the diagnosis. So this was an kind of, incidental finding. What they found that some of the PCRs which are using the S gene for the amplification, they were not amplifying this gene, and other genes they were amplifying. So first they thought this is some mistake, some error, but then they found that this is the the missense of this gene amplification can be used as a differential diagnosis. So without going to the whole genome sequencing, which is the conventional method as of now, by using the differential PCR, this difference in the non-amplification of the S gene can also be used in the diagnosis of this. Because if the PCR, they are amplifying other genes, but not the S gene, that means it is a new variant. So you need not to go to the whole genome sequence, but by simple PCR, you can do. So this is also very important, but this is also very true that having so many mutations, this is going to impact all, the modalities, including the monoclonal, all the three vaccines, the Oxford, the Moderna and Pfizer. The patient, they have reported that all these patients so far they have seen that they took, some of these patients, they took either this vaccine, one Moderna or Oxford or the Pfizer. So all vaccines, they have found that, breakthrough infections, they were there in all vaccinated.
Dr. Singh, I know this is premature, and I know that a lot is still unknown about this, but there is a higher chance of breakthrough infection. This is something that the World Health Organization has stated after just their, very preliminary meeting yesterday of the technical advisory group. My question is, do we know if our vulnerable population will be protected from severe disease? So even if people are getting infected with the new variant, which is highly transmissible, that's what Dr. Mehta also explained, will we still have protection from severe disease? Do we know any of those answers just yet?
Risika, this is only speculation, we can say. Even WHO said that as of now, we don't know. We don't know, but, these are only speculations that probably vaccinated people may not be so protected against the infection. But your question mainly is for severity, we don't know as yet.
All right. Well, I am going to give the last word to Mr. Goyal, who's been listening very patiently to this conversation. Mr. Goyal, as someone who works in the travel industry, as someone who understands these spaces, isn't good news by any stretch of imagination on a day when India's decided that we're going to, open regular flights. From the 15th of December, you actually have 14 countries that have doubled down and imposed travel restrictions on South Africa. This is expected to snowball into travel restrictions in other parts of the world, as well as news of this variant spreading to different corners of the world actually picks up. How are you looking at these developments? Do you think India will still go ahead with reopening travel, normal, regular travel from the 15th of December?
See, this disease is not going to go. Variant after variant, as mentioned by the experts, is coming up. But we have to learn to live with this disease. And the only way to learn to live with this disease is not to have full protection. You see, now in India, we have the world's fastest vaccination drive. And we have been able to sustain, compared to a lot of other countries, the spread of this dangerous disease. So I'm not a medical expert, but it is common sense that, you see, you cannot, the air is polluted, but you have to still breathe, and you have to breathe with a mask. Similarly, if you have the protections and people coming from, South Africa or other countries, it's government is justified not to, allow air travel from there. But yes, at the same time, you see, if people are coming, then you need to, have protocols at the airport of retesting them and isolating them,
right,
as we did in the beginning. So I think this is a very good news, and government should definitely, it has been announced and spread all over the world.
To be, just to add a disclaimer, while I know you welcome the news that we're resuming regular flights from the 15th of December, just to put these events, in the right chronology, that announcement that India is resuming flights came hours before the World Health Organization actually designated Omicron as a variant of concern. So we don't know whether those decisions are actually going to be re-looked at, given what the WHO has said late last night. But thank you all very much for joining us. This is an important story, one we'll track here on NDTV very closely.